And many countries are on alert, taking independent measures to prevent Zika from crossing into its borders and spreading further. As for Korea, the Korea Centers for Disease Control and Prevention also held a very special meeting to discuss the situation at home, with the best lines of defense right now being heightened monitoring and public education. It's a feature story from Lee Ji-won tonight.
The Korea Center for Disease Control and Prevention convened on Tuesday to assess the level of local threat posed by the Zika virus. As part of an action plan, it announced it would keep close watch on mosquitoes, the main transmitters of the virus, by studying their presence and movement around the country. It'll also expand public safety campaigns to spread awareness about the virus and infection symptoms, not just for citizens, but also visitors who enter the country. It also started operating a website introducing and explaining the virus. This comes on the back of the WHO's declaration of the virus as a public health emergency of international concern and growing fear. Zika is a mosquito-borne virus that generally causes mild symptoms in adults, including low-grade fever, rash, and red eyes. But it's also been linked to brain deformities in newborns. Outbreaks have historically occurred in remote parts of Africa and the Pacific Islands, but it has quickly spread to South America and other regions since it was found in Brazil in May of last year. There are currently 28 countries that have reported new cases of the virus in the past 2 months. But not everyone is fully aware of information on the virus. And there's real concern about the potential spread of misinformation regarding its effects and how it's transmitted, which is one of the biggest points of misunderstanding.
I heard that the virus could be transmitted through blood transfusions or sexual intercourse. If that's true, the virus could spread more easily and become a really big threat.
Experts say there's a low chance of an infected patient transmitting the virus through blood, such as in transfusions. It's an infrequent mechanism, and no cases of this have been recorded. However, there was one report of the virus allegedly spreading through sexual intercourse. In 2008, U.S. biologist Dr. Brian Foy, who had been infected with the virus during his research in Senegal, infected his wife, who had not left the state of Colorado. But experts say evidence of this was not confirmed and data was insufficient to warrant a related warning.
When a patient has a high level of the virus in his or her blood, there's a chance it could spread into other bodily fluids, such as semen, which leads to the possibility of it being transmitted through sexual intercourse. But the chances of this happening are very slim, as a set of extreme conditions has to be met. So it's not likely that person-to-person sexual transmission will become a main route.
But with the virus found in Indonesia on Monday and in other parts of Asia, there are concerns that the virus could eventually find its way into Korea.
It hasn't been long since we've recovered from the Middle East respiratory syndrome outbreak, so if the virus comes to Korea, I think it will create a lot of fear.
Local authorities say there's a very low possibility that the virus will spread in the country.
The mosquito that transmits the virus is the Aedes aegypti, better known as the yellow fever mosquito, which is famous for spreading dengue fever or yellow fever virus. But this mosquito doesn't exist in Korea. We do have the tiger mosquito, which has been known to transmit dengue. But mosquitoes are inactive in the winter, and no cases of Zika have been reported yet.
The Korea CDC and medical experts reiterated the low possibility of the Zika virus spreading in Korea, calling the current phase a stage of concern. But they have prepared measures to deal with suspected cases in order to promptly diagnose patients and follow through with medical support or a quarantine if needed. Lee Ji-won, Arirang News.